Aetna Better Health of Ohio is proud to partner with Ohio Medicaid and Medicare to provide coordinated health care for Ohioans through the MyCare Ohio program. Aetna Better Health of Ohio has one mission: to help our members live a healthier life. The MyCare Ohio program supports our mission by coordinating physical, behavioral, and long-term care services for adults 18 and older. Together, we are helping Ohioans live healthier in the communities where they live, work, and play.
I chose Aetna because I'd heard pretty good positive results about them, and I wanted to see how they would do.
They had the majority of my doctors and other providers already in the network, so it just seemed like the logical decision to go that way.
I'm bipolar, and they have excellent mental health assistance, and I also have a wide variety of problems such as a bad heart and the diabetes and high blood pressure.
Before I was in with Aetna, I spent probably a good close to 4 years in a severe depression. I mean, pajamas, fetal position on my bed, jar of peanut butter and a glass of water next to the bed.
I tripped and fell getting off a plane in Minneapolis. And I have almost no memory of that entire year that I spent in and out of hospitals with major surgeries. I couldn't feed myself, I couldn't eat, I couldn't go to the bathroom.
The services that I receive the most of that are daily are basically my home health aid, as far as, getting up in the morning, going to bed at night, just preparing meals, transportation, all that kind of stuff.
I thought it was a little intrusive at first, and they want to come to my house and they want to talk to me and they want to help schedule me appointments, and it was a little overwhelming. Little did I know it would probably end up saving my life.
Aetna and every provider and myself, we're all on the same page, and we're all working from the same playbook.
If I needed a neurosurgeon, I got it. If I needed a brain surgeon, I got it. If I needed an epidural, I got it. Everything I needed, everything that a doctor had suggested that I have, I got.
Right now, Aetna is helping me to get a wheelchair repaired. And that is essential for me because the wheelchair is my main means of mobility. I can't walk, I've never walked.
The case managers that I've had with Aetna Better Health give me the impression that they're general advocates for me when it's getting me the care or equipment or whatever it is that I need.
When somebody shows up on my doorstep and says, "I'm from your insurance company and I was just wondering how you're doing," wow.
I love my case manager, Birdie. She is the most wonderful person there is.
I have a high level physical disability. I strive to live as independently as I can, and I feel that the case managers and other people I've worked with at Aetna have done their best to assist me in that goal.
Not only am I only having to deal primarily with one person, but I can communicate with her and she will communicate with me within a reasonable time frame.
She helped me not only find my doctor, if I need something, other special care for eye care or dental care.
I had my lift chair break, and within 3 days, Deb had somebody out there looking to fix it.
Those of us who need dependability will have dependability.
I don't have a lot of people in my life, so having someone who's actually caring that I don't even know, well, maybe I am worth it, and I put forth that effort and I feel better and better each day.
By finding the right doctors, I've lost a little weight. I no longer walk with my cane, so it has improved my health immensely.
A year ago, the only way I could get from a chair to my bed was a slide board. I've come back to where I'm able to use a four-wheel walker. I hadn't been able to walk my dogs around the block for 2 years. I'm able now to make it around the block.
I would be in a facility without this type of care, and that really is a scary thought.
If anybody was having a bad experience with their insurance, I would just tell them that all you got to do is go to Aetna.
So many insurance companies build walls and build blocks, and you can't do this and you can't do that, and if you do this it's going to cost you, if you do that it's going to cost you. And they never ever said anything against what we had to do to get me back to where I was.
Having a good insurance company is very important to me. In fact, it's essential for me. And Aetna has been proving to be an insurance company that has a heart.